This is commentary about the poem called Anesthesia. Every time an anesthesiologist discusses anesthetic options with a patient, the anesthesiologist strives to balance candor and disclosure of risks with the need to be reassuring and to minimize anxiety. And for most patients, anesthesia is a very safe procedure. But often sleep is invoked as a metaphor for anesthesia by the patient or the healthcare provider. Anesthesiologists use the metaphor as a way to reassure the patient that he or she will wake up at the end. All will be well. After all, the patient wakes up every morning. But of course, anesthesia is not sleep. An emergence from anesthesia, where frequently the patient is just starting to breathe independent of assistance, is not the same as waking either. But this poem is a meditation on the metaphor of anesthesia as sleep, and of the journey that the patient takes as part of the consent to have an operation and an anesthetic. Ultimately, I hope that the poem is a tribute to patients who trust a complete stranger, the anesthesiologist, with their lives. Surgical patients are extremely vulnerable emotionally, particularly those such as when scheduled for cancer surgery, and physically once under the anesthetic. We as anesthesiologists like to comment that there may be a thing that's called minor surgery, but there's no such thing as minor anesthesia. This poem was published in the Journal of Medical Humanities with an accompanying commentary, and in that commentary I comment that the poem had a long gestation. I'd been thinking for many years actually about this metaphor and about anesthesia, and I'd written an academic article published in Anesthesiology. Some people who read both the article and the poem have commented to me that the poem actually explains the tension within the anesthesia sleep metaphor much better than this very detailed, lengthy article. So I think that's an attribute of poetry.